also join this course. So now we are starting our lecture. Today's lecture is on confirmation of pregnancy. You will all feel exclaimed that why I had kept this lecture. It's not a big deal. Just do the urine pregnancy test. Just do the ultrasound and you will see. But as a consultant, this topic is very important to know, as we have to look for physiology as well as pathological things. Not only confirmation, but we have to keep in mind other pathological condition associated with pregnancy. So that's why it is important to know different types of methods for the confirmation and whether it is normal going pregnancy or whether it is a pathology or any associated disease or not. That's why it is this lecture I am going to take. These are very basic lecture, but if you properly understood this, then gradual lecture will be very easy for all of you. Tomorrow there is a lecture for antenatal screening. So there we will discuss all the investigations part, what investigation at a what right time you will going to prescribe and how will you interpret it. To know that, you should have to have this diagnosis and this part also you have to know. So let's start. Confirmation of the pregnancy. First, duration of pregnancy is 9 months 7 days. Total actual duration of pregnancy is 9 months 7 days or 280 days or 40 weeks. So, as we all know, either it is 9 months 7 days, 280 days or 40 weeks. Calculated from the first day of the menstrual cycle. This is called menstrual or the gestational age. How we calculate LMP and EDD. Suppose her last menstrual period, suppose today, is 19th June 2020. So her EDD, you will see in any all obstetric cases LMP and EDD written. So suppose you are checking with ultrasound. In ultrasound, every visit, every scan, dates will be changing, because it's a subjective phenomena. So you will be getting confused. So I will recommend all of you, at a first pregnancy visit of any antenatal patient, you will have to write it down, LMP and the EDD. LMP is last menstrual period and EDD is expected date of delivery. How will you calculate that? LMP, suppose patient's LMP is 19th June 2020. So EDD, what we are doing? First from month, 6 minus 3. So it's a third, and add plus 7 days. So 19th plus 7. So it is 26th, 2021. Got it? Minus 3 from month and plus 7. Please. कोई बात नहीं, देख लीजिए. How will you calculate LMP and the EDD? Simple LMP is 19th June 2020. Okay. So, for EDD, what will you do? Minus 3 from the month. Suppose it is 6. So, you will do minus 3. So, you will get March. Add plus 7 in the date. So, 19 plus 7. So, 26th March 2021 is her EDD. Simple, you have to add 9 months 7 days in the LMP. So any expected date of delivery, you will going to calculate from the LMP, last menstrual period. Because what happens when patient comes to you, they will tell that, ma'am, fertilization was on the 15 days back, 16 days back, 2 days back, and you will be wondering. And most of the people are take means they depend on the ultrasound, but every time ultrasound is not going to helpful. As I tell you, ultrasound is a subjective phenomenon. Every time they will show the different dates. So you don't bother that date. You stick to your LMP and the EDD what you have made. So everyone got it? How you calculate IDD from the LMP? Dr. Renu, clear? Simple. Minus 3 from the month, add plus 7 from in the date. Problem when happens, you know, suppose here 19th February 2020, then EDD, anyone can tell me? 19th February 2020. Anyone can tell? नहीं. Here we will not going to calculate exact day to day. We will consider 30 days cycle. 30 days cycle. Yeah, very good. So I think everyone has clear idea regarding LMP and the EDD. Okay. Now, the first we will discuss the symptoms. In a first trimester, first trimester. First trimester means first 12 weeks are termed as a first trimester. How patient present to you? Patient will present to you as a amenorrhea. Usually in all cases, sometimes cyclical bleeding spotting up to 12 weeks can be there. It is called placental sign. Amenorrhea should be there, but in sometimes at exact date there is a mild spotting patient feels. Up to 12 weeks, due to up to 12 weeks placenta is developing. So that is termed as a placental sign. But this bleeding should not be confused with pathological bleeding. Pathological bleeding is threatened abortion and the missed abortion. So, you have to differentiate between the placental sign, it's a normal bleeding, or it is a pathological bleeding. How will you differentiate? Placental sign or the physiological bleeding will going to happen only on a fixed date. Suppose 19th June is LMP, then 19th July spotting, 19th August spotting, lasting for very few minutes to hours and in a very mild quantity. Whether pathological bleeding is not related with date, severe, associated with pain, and can happen anytime. So you have to differentiate from symptoms and do confirmation with the help of ultrasound. Second, patient is presenting with nausea, vomiting, that is called morning sickness. It can last up to 16 weeks of the pregnancy, mostly seen in 70% of the cases. Patient feels nausea, vomiting and please बोलिए 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 डॉक्टर रेनू. Anyone have question? Anyone have question or I should go further? I am audible to everyone? Okay, okay. There is a nausea, vomiting, that is morning sickness, last up to 16 weeks, mostly seen in 70% of the cases. Nausea, vomiting and loss of appetite are very common presentation up to 12 weeks of the pregnancy. Frequency of micturition 8 to 12 weeks of the pregnancy due to edematous mucosa, bladder mucosa, there is an increased frequency of micturition. Why? Because resting of bulky uterus on the bladder. There is a congestion of bladder mucosa and change in maternal osmoregulation. Osmotic जो changes होते हैं that is going to take place. So that's why patient having complaint of polyuria, that is very common in first trimester of the pregnancy. Patient having breast discomfortness, feeling of fullness and the prickling sensation as patient breast means pregnant lady's breast is preparing lactation means milk production for in a future. So breast हाँ बोलिए बोलिए डॉक्टर रेनू बोलिए बोलिए there is a fatigue and the lethargy. Patient may feel fatigue and lethargy. So all are these symptoms present in the first. हाँ बोलिए. You want to ask some question? Dr. Renu, you want to ask question? Patient feel fatigue and lethargy. So these are the common presentations we feel in the first trimester. What they are? Amenorrhea, morning sickness, polyuria, breast discomfortness, fatigue and the lethargy. Now, these are the clinical presentation. How patient presenting to you. First of all, they will tell you, miss period, I have pain in my breast, I have polyuria, I have morning sickness and I feel fatigue and the lethargy. They are presenting to you with these symptoms. Now, as a consultant, your duty to confirm it. How will you confirm? First, if patient having breast problem, you can examine the breast. Breast changes are very important in a prime. Nipple become more pigmented and dark. Montgomery's tubercles are present like in the small tubercles around the nipple and on the areola. Hello, I am audible to everyone. Okay, because someone had messaged me, text me, I am not audible. I, I am audible. Audible. Hello. Okay. Okay. So there is a nipple become more pigmented and dark. Montgomery's tubercles present. What is Montgomery's tubercle? They are small, elevated portions around the nipple in the areola that are called Montgomery's tubercle. Yellowish secretion called colostrum can be secreted by the 12 weeks. So these are the breast changes you see in a pregnant ladies. Per abdomen examination, uterus remains pelvic organ till 12 weeks. It can be felt It is felt as a